A lot of people don't just deal with back pain once. It comes back, sometimes weeks later, sometimes months later. Sometimes it feels like it never fully went away at all. When that happens, the natural question is, why does it keep coming back? In most cases, it's not because something is repeatedly going wrong. It's because the underlying factors haven't fully changed. Back pain is rarely caused by one single event. It's usually the result of load exceeding what the body can currently tolerate. That might be lifting something, sitting for too long, or even just a gradual build-up over time. When the pain settles, people often assume the problem is gone, so they go back to doing exactly what they were doing before. Same habits, same activity levels, same patterns. But if the body hasn't actually increased its capacity, the same situation will eventually trigger symptoms again. This is one of the main reasons pain becomes recurring. The symptoms improve, but the system hasn't adapted. Another common factor is incomplete recovery. Pain might reduce enough to feel manageable, but that doesn't always mean the body is fully ready for normal demands. If activity increases too quickly at that point, symptoms can return. There's also the issue of inconsistency. People often do the right things for a short period. They move more, they follow advice, they build momentum. Then, as soon as they feel better, everything stops. And over time, capacity drops again. This creates a cycle. Pain improves, activity increases, activity stops, capacity drops, pain returns. Another important factor is sensitivity. Even after tissues have recovered, the nervous system can remain more reactive for a period of time. That means smaller triggers can still cause symptoms. If the body hasn't been gradually exposed to movement and load again, it stays in that more sensitive state. Fear and avoidance can also play a role. If someone becomes cautious about certain movements, they may avoid them completely. That reduces exposure and prevents the body from adapting. Over time, this can make the system more reactive, not less. It's also worth noting that recurring pain doesn't necessarily mean worsening damage. This is a common misconception. Pain is not a direct measure of damage. It's a response from the system. The key difference between one-off pain and recurring pain is usually management over time. People who break the cycle tend to do a few things well. They build capacity gradually, they stay consistent with movement, they don't stop everything as soon as pain improves. And they understand that recovery is not just about reducing pain, it's about improving what the body can handle. The goal is not just to get out of pain, it's to reduce the chances of it coming back. That means changing the inputs over time, not just reacting to symptoms when they appear. The key takeaway is simple. Back pain often comes back because the underlying capacity hasn't changed. When capacity improves, the same triggers become less of a problem, and the cycle starts to break.